Now we can take that same problem down to a much more mundane level. It's not death and dying. It's a rather minor procedure. Lifestyle choices about diet, exercise. Um, One of my favorite cases in teaching involves how long to leave a cast on a broken arm. Most of my medical residents assume there's absolutely nothing ethics in that question, until we discover that there's no scientific fact about exactly how long to leave a cast on. The earlier you take it off, the more comfortable the patient will be, but the greater the risk of injuring the bone. So depending on how careful you want to be with that broken bone, you'll take the cast off a little bit early or a little bit late. There's some times that are just way too early. No reasonable person would take the cast off after a day. No reasonable person would leave the cast on for 6 months. The muscle begins to deteriorate. But there's a range. Is 6 weeks right? Is 7 weeks right? Is 8 weeks right? Depending on the bone. There's room for discussion. And so a good orthopedic surgeon, even after a major orthopedic intervention, is going to have a little conversation with the patient to figure out how long you leave the cast on. And that's what I mean by taking this question down to the mundane level. Is penicillin good for a patient with pneumonia? Well, for most of us who want to live, it's a great drug. If we've had a history of anaphylactic shock, it's not such a great drug. But if we're 95 years old with metastatic cancer and well prepared for our dying, sometimes penicillin interferes with the pneumonia we used to call it the old man's friend. These are religious matters, but they're matters about which many of the major religious traditions have quite sophisticated views. Catholic views that we've talked about do not require preserving life at all costs. They talk about treatments that are extraordinary, by which we simply mean treatments that offer more burden than benefit. And again, that we see as a function of the patient's beliefs and values about what counts as a benefit, what counts as a burden.